the News Channel 5 network, this is MorningLine with Nick Barris.
Good morning, everyone. Thanks for joining us on MorningLine. Nick Barris here with you, live and direct from Studio A in downtown Nashville, News Channel 5. And on today's edition of MorningLine, we are going to do open phones. We also are going to have a Skype interview that was pre-recorded that we're going to play for you here in a moment with an expert from George Washington University out of D.C. This guy, Dr. Carlos Rodriguez Diaz, is an assistant professor and an expert in public health. And we talked to him briefly yesterday to get some, I think, opinion from outside the area. You know, we talked to a lot of them locally, and many of the same messages are being shared across the country on some of what's happening and how we can see potentially a light at the end of the tunnel with regard to this coronavirus. We will open up the phone lines right after we run that interview, 737-7587. And certainly today we're not going to talk about just the coronavirus. There can be things related to it, of course, and there are other stories making news as well, even though that seems to dominate it. And I did mention Skype, and just want to say that as many of you continue to, I think, stay home and isolate per, the medical experts' recommendations, you're going to need information as it goes. And I can tell you here at the News Channel 5 network, we are going to continue to cover the news. I'm here at the studio, I come in. We're working in a way where we can have some crews stay in the field and never come to the station. We're certainly limiting guests and visitors to the station. As you know, on MorningLine, a lot of times we have guests. We will continue to have them in a limited capacity, but when we can't, we can do things like Skype. The wonders of cell phones and other modern technology have really changed the playing field for us and will allow us to continue to cover the news for you. So wherever you are, just know that we will always be in touch and we will continue to cover the story for you no matter what. So you can always tune when you're at home and find out what the latest is either on your TV or by just logging on to one of our websites. So we continue to be here and we have a game plan. Look, sooner or later, is someone at this station going to be exposed or test positive for the coronavirus? Probably, as we've seen at a lot of other businesses. If and when that happens, we'll have to evacuate the building. And we have plans to bring you the news from another location while they come in and sanitize this building, in which case we'll be back. That's the way this is going to work until things clear up. So let's go, before we get to the phone calls, and we'll open it up and I'll set the table with you with others. I want to play this brief Skype interview for you. It's only about 8 minutes or so, where I talked with Dr. Carlos Rodriguez Diaz. He's from George Washington University, an expert on public health, just about where we stand right now. And we'll lay that out for you, and then we'll get back and open up the phones and we can talk. Let's have that interview now. All right, Nick Barris here in Nashville, Tennessee, and I am doing a Skype interview right now with Dr. Rodriguez Diaz, and he is a community health scientist with years of experience, and we're going to talk, as you might imagine, Doctor, about the coronavirus, obviously a worldwide pandemic. You know, we're dealing with it in Middle Tennessee, as I'm sure you are also in Washington, D.C. Kind of wanted to start first with something we heard the president say just within the past 24 hours. He's saying at this point we do not need a national lockdown like we've seen some other countries do. At what point, do you agree with that? And at what point do you think we may need to take even more drastic measures than we're doing right now?
Well, first of all, thank you for having me and the opportunity to participate in this process that is so important of educating our communities. Listen, I think that we need to all realize that we are dealing with a new virus. Things are changing very fast, and the decisions that we have to make in order to respond to the community needs will change dramatically very fast. I think that we are very close to having to implement other measures that perhaps are not very nice and we might not like them, but it's the right thing to do so we can all stay healthy and reduce the amount of people who are getting infected.
What would those measures be then? Would it be something like right now, for instance, I'm able to go out from the station and maybe go down to the market and buy some items and come back here. I might even go to the gym later. What would be the types of measures that really would be in place beyond what we're doing right now?
So the measures are what we are calling social distancing, basically reducing the social interactions that we have or how many people we interact during the day. That means reducing the amount of activities that we do out of our household, and perhaps for those of us who cannot stop working, and like you guys that you have to continue going to different places, it's reducing the impact of getting exposed. For example, it's very likely that bars, restaurants, gyms will be asked to close, and to close for several weeks. However, supermarkets, pharmacies, hospitals, and other services that are necessary for us to keep living and keep getting the things that we need to be okay will be within the limits of things that we can do. Certain limitations might be put in place, including the amount of people that can get into a store, for example, or some measures to make sure that people who are getting to stores or public spaces are not sick. So, for example, taking the temperature of people who are entering closed spaces.
How confident are you that if we follow those types of guidelines and do what we're supposed to do, that we will see things get better?
Oh, I am very confident that if we do the right things, that is reducing social interactions, that we increase testing so people can certainly know if they're infected or not, we can reduce new cases or new infections. What I am not certain is how long it's going to take, because we need to start acting very soon. I mean, we are past due for some actions, but if we implement the right public health practices, we will see a future without everything that we're seeing now.
I'm wondering, we can learn from other countries that saw this virus first. What have we seen, as far as you can tell, out of China with regard to what they've done? Have things improved there in the weeks since they started taking some of these steps, since that's where it all began?
Well, yes. We need to see what other countries are doing. We can learn from those practices that have been good, so with good health outcomes, and also considering our political and economic circumstances. So, for example, something good that China and many countries in Asia did was to make testing available very fast, and basically testing as many people as possible. That's something that we are not doing here yet. And I am concerned, the public health and the scientific community is very concerned, because we need to have tests available. So that's, to me, one of the best practices that we can learn from other countries.
And have we seen, because them doing that things have gotten better in China and South Korea?
Yes, things have gotten better, because by knowing who has the infection, we can provide proper care. And we can also increase the activities or recommendations that we can provide people to stay home or to do or not to do certain things, so they can reduce the exposure and reduce the ability that people who are infected can have to be vectors. Listen, a very important aspect of this particular pandemic is that people who have the infection might be asymptomatic, meaning that they have the virus, but they don't have symptoms. And during that period of being asymptomatic, people can transmit the virus. However, if the person is tested and is positive, like the case of Idris Alba right now, he knows he's positive. He has shared that on social media, and by knowing that he's positive, he is isolating. He's practicing self-isolation, and in that way, he reduces the risk of infecting others. And if we have tests and we know who's positive or who is carrying the virus, we can implement better prevention practices.
Okay, let me ask you this. If you can just look ahead, let's just assume that, the United States does more and we start doing exactly what you and other experts have said. How will this play out? What will be the end game, if to the point where we finally do start isolating everyone and we reduce and maybe eventually stop the spread? What will happen to the virus? Will it die out? Is it something, especially when it gets warmer, that it will go away? How will it finally leave if we reduce the spread?
Well, so I would like to add to your premise that we need to act now. So if we do what we have to do now, yes, we will see the outcomes will be to reduce new infections. And by reducing new infections, we will see less people getting sick. with less people getting sick, we have less of a burden to the healthcare system, so less people in hospitals and requiring intensive care. And eventually, we will eliminate the virus from our communities. That will take months, but because we will have less people and we could identify who those are, we can provide the specific measures that are available so we can reduce the community infection. And by doing that, eventually we will reduce very significantly the amount of people who are positive and therefore those who are able to transmit the virus.
Okay, and what I really do hear from you, it's very important that everyone get on board with this. Has there been some frustration from your point of view that maybe the United States government, which has all these resources, has been a little slow to react to this, and that there are many in the public who even today still think it's no big deal?
Well, I cannot speak for the scientific or public health community. I can speak for my own perspective and what I've heard from my colleagues. And overall, I think that there is a sense of frustration, particularly with the pace in which we are responding to the emergency. I think that we are doing the right thing, but it's taking longer than what it should. And we are now with more specific recommendations coming from CDC. Now the invitation is to local governments to take action. As probably you've seen, cities like San Francisco or states like New York are taking measures that will help in controlling the virus. And we need more of that. So I think that within the next 24 hours, we need to see more governors and more local governments taking action. The state and local communities have the public health expertise to do this, but we need the resources, and that's why the state of emergency is going to be a helpful tool to make resources available for public health professionals all over the country.
Okay, one last question real quickly. Is it your belief and hope that as we do all of this, at some point there will be a vaccine developed?
Well, so the vaccine is under development already. The thing is that to get a safe vaccine takes several months. Recently, probably earlier this morning, I heard from Dr. Fauci that we are, and I shouldn't quote Dr. Fauci, I've heard overall, now I'm getting so many sources of information that I'm a little confused. But overall, answering your question, I think that we are at least 12 to 16 months from having a vaccine. But scientists are already working on it.
Gotcha. Dr. Rodriguez-Díaz, thank you so much for joining us from Georgetown. All right, there you have it. That's great. I hope you took some from that. Much of it you already knew. But part of the reason we did that, quite frankly, was it gave us an opportunity to test our technology out and actually use it on air. And I thought it went well with Skyping. And so as we try to continue to bring you information and have guests, sometimes we may even be able to do something that live. We can do it without bringing them into the studio, so we don't have to worry about contamination potentially. And we can do it with Skype interviews. And that worked great. Listen, we'll take a break. When we come back, we're going to open up the phones. It's open phones Wednesday instead of Thursday today. And I'll set the table more for you with other topics besides just the coronavirus. And then let's take your calls right after this. Stay with us.